Hi guys, it's here Instrument Innovations once again. I'm here with Shane and with Kristi. We're all on site this week, so we thought we'd do something different and do it this week. This month is National PPE Month, so we're going to talk about a webinar centered around PPE and talk about different things about PPE, how since COVID it's got a little lax, what we've seen with the PPE, the importance of having the PPE. So we'll just get right into it. I'll first let Shane and Kristi tell a little bit about themselves, what they did previous to this, what they're doing now with the Cinco, and we'll jump right in.
Hi guys, I'm Kristi. I have done 8 years in SPD and transitioned to Asenco about 6 years ago and have been doing it ever since. I work on work on data.
All right.
Perfect.
Shane, tell us a little bit about yourself.
Yeah. Shane, I served 2 years as a manager of sterile processing department and been with Asenco for about a year. I as well do data, helping take clients live with our system.
So let's just jump right into that whole PPE thing. First of all, let's talk about PPE or personal protective equipment, if you will, and what that is and what's the importance of it. So, who wants to talk? Just jump right into that first.
Well, PPE is your gown, your gloves, your mask, face shield, everything that protects you from anything that you're going to be touching in the department. It is very important, especially to use universal precautions.
Mm-hmm.
Every patient, you don't know what they have.
Right.
And so you want to make sure that you're gowning and wearing your gloves and wearing your face shield every single time because you don't know what that patient could have.
Mm-hmm.
There is no reason to treat one patient different than a different one. So every case that comes into decontam, you're going to treat that same as every other one.
Yeah, that's right. PPE, personal being the key header, that you are protecting yourself from the risk of contamination from this job, which is very high, considering patients that we take care of and the things that we come into contact with, from blood to tissues and all of those different things. We should protect ourselves so that we can, be healthy and get home to our families and take care of our families. And so it starts with PPE, but also we're protecting other patients, from being contaminated, cross-contamination, and those sorts of things. So
to kind of piggyback on both what Kristi and Shane was talking about, that protective equipment here in sterile processing, that PPE or that protective equipment, before there was a COVID or before there was any other thing in sterile processing, every day of sterile processing's jobs is hazardous. We don't always know what the instruments are contaminated with. So we have to treat everything as if it's the worst thing possible, and we have to protect ourselves accordingly. To also piggyback on what Shane was saying, that when he was talking about, it's not just to protect ourselves, but it's also to protect those patients. You have some patients that are immunocompromised. So just a simple cold or anything could affect them greatly. So we got to protect them by putting a mask on, or protect, or just not even showing up if we're sick, because the smallest thing could be detrimental to them. Right. So go ahead.
A lot of times, a small case cart will come in and you just throw some gloves on and throw it in the washer. You think, oh, I'm fine. It'll be fine. It's just one set. Well, what happens if you get splattered on your scrubs and you don't know it, and you go up to the cafeteria?
You just spread that out.
You just spread that everywhere.
And it's not necessarily the stuff that we can see that affects us. It's those things or those microorganisms that we can't see, or those little splatters that we can't see that happen that get to us, and we've already spread it to other areas of the hospital.
Right.
So something as simple as not taking those shoe covers off when we come out of decontam and switching them out, or having those dedicated shoes, and then we're tracking it from decontam all the way throughout the rest of the hospital. So, and then with talking about PPE and everything, I think it's gotten really, really lax since COVID, because COVID, it heightened everybody. Everybody was on high alert. But since we've kind of, COVID hasn't gone away, but we've kind of trended down with it. Notice that people are starting to get lax. So what are you guys saying with that?
Well, there's not just being lax about it, but there's shortages.
Mhm.
It's hard to get these. And if you do get it, they're the wrong size. And so people can't wear them. Or
Do you think that's some of the reason that people tend to, because there are shortages, they just say, oh, well, I'm just not going to do it. I'm not going to wear it.
Yeah.
Or
they're so tired of being completely covered head to toe from COVID that they're just, I'm done with this. I don't want to do it anymore.
Mhm.
Yeah, I think the one thing we see most is, being in decontam, that last level of protection is that face mask that we would wear underneath our shield.
Yeah.
People are tired of wearing a mask, so they don't want to put that mask on.
Yeah.
And they're like, oh, I'll just hold my head down and I'll be protected from the splash from the shield. But it does not work that way.
No, it
And
doesn't.
we've seen that in the trials and the experiments that they've been doing with the Ofsted study, and all of those that splashes are real.
Yeah.
they
Right.
Oh,
they
yeah.
will go wherever they want to.
Exactly.
I think the other thing that people don't realize is if you've ever had to wear the PPE, then you understand it. But if you've never had to wear it, it's uncomfortable. It's hot.
Yes.
It's hard to breathe in it. And if you're not used to that type of thing, it gets very cumbersome. And I think that people just get to that point where they're like, I'd rather take my chances. And that doesn't mean it's okay, by no means. But they're like, okay, I'd rather take my chances and deal with this than deal with that uncomfortability of that.
But you also have to remember that if something does happen while you're in there, your hospital's going to be paying for
Absolutely.
your mistake.
Or that's something that, because you didn't follow the rules of what they're supposed to, now they are not going to take care of something because you didn't follow the rules.
Right.
Yeah, when you fill out the paperwork for workman's comp, it's going to ask you if you were wearing
Proper
all your
PPE.
proper PPE.
Absolutely.
And if you check yes and somebody else said no, they were not wearing PPE.
Because the one thing they're going to do is they're going to do their investigations. They're going to ask, was there anybody else that witnessed it? And they're going to say, did you notice them wear their PPE, or were they doing the proper body mechanics? All of the above. So, all right.
So, playing on PPE, something that I was trying to do in my department before I left was we were going to start using togas in decontam.
Okay.
And if you're familiar with the toga, they use them in joint replacement surgeries. It's a full body covering they have available. You put a helmet on, and it has a fan that keeps you cool, and you're covered from head to toe. Once you put your gloves on, you're totally encapsulated. So you got a fan to cool you off in that hot environment, and you're fully covered, so you're not going to hit, except for your feet. Which you can use your full boots or.
So now tell me, talking about the togas, what is the downside to using those?
Downside is cost, obviously.
Right. Yeah.
It is a higher cost comparative to that normal blue gown and the shield.
And you have to charge the batteries.
And
make sure that they charge them.
That's correct.
Yeah, because with those, one thing, not to cut you out, Shane,
Yeah.
but one thing with those is you have to use the fans, because if you've ever been with those without the fan on, they are hotter than just wearing the regular PPE.
And
So
you can't see. You're
Right,
fogged up.
right.
Yeah. So you have to have that. So even that has its downfalls as
Yeah,
well.
yeah, correct.
Mhm.
And that one, a Shane's idea. I saw that in Inside Issue, where another sterile processing manager was using that method. Now they also do have just the hood that you can incorporate with the normal gowns that you would use, and that is less of a cost than the full toga, but there still is that cost associated, that battery.
And then the other thing
associated.
with those is anytime you use those, the hoods or those, there has to be a separate training that you have to do before they can even utilize
Yeah.
those. Because anybody that hasn't gone through the training can't even, they're not even supposed to have that on.
Right.
Do people really get training on how to put on and take off PPE though? I know I never did.
That should be our normal competencies that we have to do.
Right.
And not only that should you be trained on that at your orientation, but the hospital that I came from that was a competency we did every year, yearly.
Right,
You had to recheck off on that.
I have only just seen a poster on the wall.
Wow.
Wow.
Yep.
Yeah.
Wow.
Yeah. At my facility, they did training on
Mm-hmm.
now normal PPE, not decontaminant PPE, but they did training on donning the blue gown and putting gloves on and putting on the shoe covers in regular orientation. But yes, in the department, we should be doing,
that should be an annual competency.
And, let them know how important it is and why you're doing it the way that you're doing it.
And that we would hold them accountable.
Right.
If they're not wearing it, then we are going to have a conversation.
Exactly.
And then if it becomes a problem, then I'm going to have to, discipline you.
Yep.
So one thing that when we're talking about PPE and decontam, let's talk about this red line. So this is going to be a two-parter question. The red line. Tell us about this red line and what this red line is, and then the PPE related to this red line. Where is the PPE usually, and where should it be?
Mm-hmm.
So,
yeah, I mean, Kristi can back me up on this, but within sterilization or within an SPD or sterilization department, you have technically two red lines, right? So you have the red line that is no access beyond this point for anybody not in surgical attire, right? Not in attire being worn. Then you have that secondary red line, which is in your decontam area, which is no access beyond this point without PPE. And so you must have, the blue gown, the shoe covers, the gloves, the face shield, and the mask on when you come into this area.
So in relation to that, where usually do you see is the PPE that I'm required to put on? Is that before the red line, or is it usually located past that red line?
It's usually after the red line.
Yeah. So how would
but there's not necessarily a line past that point, but you just know that once you come in the door, you put your PPE on and you can't go past that point without it.
Yeah. So here is my question on this, because I'm kind of torn between the red line. Is if decontam is just that, if all of decontam is considered dirty, why do we have a red line? Do the germs know not to cross this red line and they won't cross that red line? Or if decontam is considered dirty, why do I have all of the PPE that I'm required to put on to protect me from that in decontam in the first place?
I did see one. I have been to one facility that had a really great system for their decontam. They had a nice big room where you would change into, put your shoe covers on, put your gown on, and then you went into the department.
Right. Which is how it should be, because if we're saying that this is the dirty area, decon, And if I'm going into this area, do that I put my PPE that's already in the dirty area, then technically are my scrubs dirty once I step into this area? And if that is the case, should I change? Or I'm stirring the pot a little
Yes.
bit.
You are
So
stirring
let me.
That's kind of a rabbit hole that you.
Hey, that's why we're here. We're here to store the pot. And
Yep.
and you said it. Anything in decontam is dirty. And so if I have to go into decontam to put on my PPE, I'm putting on dirty PPE, and my scrubs are dirty
Mhm.
before I put my PPE on.
Yeah, there's air cycling in that
So-
room that it's moving stuff around.
Yeah. So you have it right. Once I leave that decontamination area, I should change my scrubs. And you know how hospitals are facing this issue, I know is storage, right? You don't have a room to
Not enough
make
space.
dedicated to changing into PPE. Then we need to either A, find the space for the
Yep.
PPE, or B, put in policy practices that require, scrub changes, that require, the decontamination person to be only in decontam, to not go into any other areas. But then, you get into, people issues then that we
Well,
don't have enough
Yeah.
people to
Yeah.
run our
Realistically,
departments.
the staffing
And every
wise,
time
we
if
have a
you have to-
national shortage.
If you have to change your scrubs every time you come out, that's 10 minutes.
Well, not just to mention a lot of areas, when we run into the scrubs, we ran into this just last week. They don't have enough scrubs to even
Mhm.
do a regular work week
Right.
with the staff.
Right.
So now we're talking about extra changes,
Yeah.
So they have all of those hurdles and workarounds that they realistically have to deal with that they can't manage already. And then adding another change into that, they can't. So
Yeah. So
I
I'm sorry.
I don't see it happening anyway.
Yeah.
I don't see people changing their scrubs.
so
But you said it. I mean, we are stirring the pot here. We are, thinking of these hard issues, but it's something that as healthcare providers, we have to think about for the safety of our workers and for the safety of our patients.
yeah,
Well,
it's what's best for the patient.
Right. And it would protect me too. I'm in that department and you walk into decon and you touch something.
Yep.
And you come back in there and you touch me.
Yeah.
I don't want that.
And you unknowingly not, you don't know what
Exactly.
has been
I don't know
touched or
where you've
anything
been.
or where
Yeah.
exactly.
Wash
And a
your
lot of-
hands.
A lot of people I've seen, just walk into decon and they'll be sitting there with their elbows on the counter and
Mhm.
no, don't do that.
So that's about all the time we have for right now, guys. You join me, Brian, with Shane and Kristi. We talked today about PPE and the importance of it. PPE is not there just because it's something that the hospital wants to do. They want to make sure that not only you're protected, but the patient is protected as well. So don't cut any corners with that. PPE is there for a reason. Let's make sure we're putting on all of the PPE. Let's make sure we're wearing it like it's supposed to and following that hospital standard. Talk to you later, guys.